Health New Zealand has told hospitals to look at cutting vacant roles and limiting overtime.
Healthcare unions say the restrictions are tantamount to a hiring freeze and are already impacting frontline health services. Political reporter Amelia Wade has the details.
Just in case you've missed it.
I can tell you what we want in health is we want more medical doctors, not more spin doctors,
The government has rolled out a line this month about the public sector cuts.
As I've said before, I want more medical doctors, not spin doctors.
Despite that, Newsub can reveal Health New Zealand has told hospitals to restrict staffing.
Well, you can call it a freeze, you can call it a cap, you can call it a lot of things, but from where we look, certainly looks like no more additional staff coming on board at a time when our health system's in a serious crisis.
Newsub's obtained an email from Health NZ to the sector saying because it's currently operating in a deficit, restrictions are needed, including encouraging staff to take annual leave, especially Friday, April 26, banning double shifts, enforcing lunch breaks to avoid extra payments, and no cover for sick staff, excluding night shifts.
The other limits on staffing that seem to be being proposed mean that it will be potentially unsafe in terms of staffing of services.
We are required to find efficiency through the system, and Health New Zealand is required to as well, but those efficiencies will be turned back into the front line to deliver safe and satisfactory services for New Zealanders.
The restrictions also included reviewing whether vacant roles need to be filled or even whether to cut the jobs entirely.
Just in the past few days, I've heard of inability to increase medical oncology services that are needed in provincial areas, of a previously approved obstetrics and gynaecology appointment that now may not happen.
This is a broken promise. National said there'd be no cuts to frontline services, but there were positions with people being lined up, and now Te Whatuora is being told not to hire.
Is this a broken promise?
No, this is not. Services to New Zealanders are protected.
Health New Zealand told us in a statement they're reminding their people of some of the things they need to do to ensure hospitals live within their means and are as efficient as possible.
I expect Health New Zealand to manage this operationally and to provide safe and effective services.
If cost savings are being requested, then that is going to have a flow-on effect to frontline services.
Services now facing a freeze right before winter.